Welcome to the Avoca Quality Consortium Knowledge Center homepage. On this homepage, you see the 10,000-foot view of all the topics covered in the Knowledge Center. Within this Knowledge Center, there are over 350 tools, templates, and guidelines for your use to customize as needed for your organization. The majority of our tools are located in the Leading Practice Quality Oversight segment of our Knowledge Center. Upon entering this area of the Knowledge Center, you will see the top tiles outlining the 8 components of Avoca's proactive quality management oversight framework. Selecting Process Oversight will take you to the variety of topics explored in that swim lane. Selecting the QMP tile will bring you to all the tools, templates, and guidelines associated with quality management plans. Here, we will view a user favorite, the Quality Management Plan template. The Joint Quality assists sponsors and CROs with clearly documenting quality expectations and standards at a protocol or program level. All of our tools in the Knowledge Center can be downloaded in their native format, e.g. Word, Excel, or PowerPoint, and are easily customized to suit your organization's needs. Moving back to our homepage, you will find our Quality Agreement tile. You can view the full Avoca Quality Agreement, or you can compile your own quality agreement by piecing together the fundamental elements that are relevant for your organization and your partnering structure. When viewing the quality agreement, you can see how easily you can download the document in its native format for easy customization. It is important to note the collaborative efforts that go into creating our leading practices. Our consortium member companies anonymously donate their best practices, which are refined, combined, and modified by subject matter experts to ensure that the final leading practice is best in class and meets current regulatory guidelines. These leading practices are subsequently peer-reviewed to ensure accuracy and relevancy. The development of new materials comes based on needs identified during Avoca industry research, our Leadership Advisory Board recommendations, and our annual industry meetings. In addition, member companies can request additional materials to fill gaps within their organization or the industry. When no initial leading practices are available, Avoca Subject Matter Experts pool knowledge to develop the initial tools for peer review. A current industry need is the understanding of ICH E6R2 implications on how clinical research is performed, highlighting a focus on risk-based processes. Our ICH E6R2 map outlines the steps in process required based on ICH E6R2 and links these steps to guidelines, tools, and templates within our Knowledge Center to leverage in order to be compliant. You will see here that the risk identification piece takes you to 3 tools within the Knowledge Center that address this requirement. The QBD IMP Intervention Risk Template is an example of such a tool that can be utilized to adequately document these risks. In addition to assisting with understanding the regulations, the Avoca Knowledge Center has an inspection readiness grid available that explores the core focus areas of the FDA, EMA, and MHRA. In 2018, these focus areas will also be expanding to the PMDA, Health Canada, and CFDA. In addition to viewing the key focus areas, the Inspection Readiness Grid also collects and shares member inspection experiences. These member experiences are collected from member companies using a standard data collection tool that allows members to anonymously provide details about their recent inspections. By compiling this information into the Inspection Readiness Grid, the Avoca Group is allowing insights into how to prepare for a regulatory inspection, and also will allow us to see changes in how inspectors are changing based on the newly implemented ICH E6R2. Also, within the inspections area of our Knowledge Center, there are many robust tools that can be used for an organization to prepare for upcoming inspections. Another area to review during this demonstration is the pre-qualification piece of our Knowledge Center. Currently, there are 8 areas of pre-qualification standards, which are expanding to 13 areas by the end of 2018. Each area of pre-qualification has a robust set of standards, an RFI template, a scorecard template, and a visit checklist template for the organization to use when pre-qualifying their high data generating vendors. The standards discuss the key components of the third-party provider that should be reviewed in order to adequately qualify the organization, as well as what regulation or guidance or requirement is being met by that review. The Patient Engagement Playbook is a newly released component of the AQC Knowledge Center, which looks at the variety of ways that sponsor and CRO organizations can implement patient engagement activities in study startup, study conduct, and study completion. These tools can help sponsor organizations gain greater insight into the patient experience, along with what may be encouraging or discouraging a patient from participating in one of their clinical trials. Lastly, with over 400 tools, templates, and guidances, it is important to be able to get to what you want to quickly. Therefore, the Knowledge Center has a search functionality to allow you to search the tools by keyword. Thank you for taking the brief overview of our AQC Knowledge Center. We look forward to speaking to you soon.